Concussions are a huge problem these days. Just about every sport has taken higher precautions when it comes to concussions. There have even been movies about concussions to raise awareness of their effects. Concussions are a huge problem at all levels of sports and have long lasting effects. Concussions are a huge problem at all levels of sports. According to Easterbrook, TMQ urges concussion awareness. Researchers increasingly think concussions are not as much the result of one big hit, but more so the accumulation effect of many smaller hits. It's sort of like how a boxer can take several hard punches and then be knocked out by a light, routine jab. This says that the way a football team practices is just as important to reducing a concussion as the way they play. Many coaches at all levels of football encourage players to hit each other hard at practice. The worst happens in high school because older, stronger varsity players are taking out the younger junior varsity players. Since accumulated effects of lots of small hits to the head are the leading cause of concussions, then football needs best practices standards for practice. Currently, there are no such standards in high school, college, or the pros. Trainers are not necessarily certified for concussion treatment. Many high schoolers don't even have access to a certified trainer. Also, coaches are not required to pass a concussion awareness course. Another problem is the trickle down effect of the pro sports to high school sports. One example is NFL players who do not wear mouthpieces or who wear the clear, invisible mouthpieces that are not meant for contact sports. This in turn makes it so kids don't want to wear the proper mouthpieces because they observe the pros without them, who they idolize. Proper mouth guards are essential to reducing concussions severities. The long-lasting and short-term effects of a concussion are vastly different. The short-term effects vary among people. According to White, they include headache and ringing ears that don't go away, difficulty remembering things, slowness in thinking, feeling tired all the time, changes in your sleep patterns, lightheadedness, dizziness, or loss of balance, increased sensitivity to lights or sound. Basically, the only way to recover from a concussion is time and rest. But to help yourself recover faster, avoid loud noises, watching TV, playing video games. Also avoid doing strenuous thinking until all symptoms are gone for at least 1 week. Most people have a quick recovery within 7 to 10 days, although some patients have the effect of concussions for weeks and or months. According to What is a CTE by Boston University, repeated head concussions can cause chronic traumatic encephalopathy, or CTE. A CTE is defined as a progressive degenerative disease of the brain found in people with a history of repetitive brain trauma. This trauma triggers progressive degeneration of the brain tissue, including the buildup of abnormal proteins called tau. These changes on the brain can begin months, years, or even decades after the last brain trauma. The brain degeneration is associated with memory loss, confusion, impaired judgment, aggression, depression, and eventually dementia. CTE has been known to affect boxers since the 1920s. With concussions being a huge problem at all levels of sports and having long lasting effects, I propose that high schools are enforced to have their athletes use the baseline concussion test. This test is proven to reduce second impact concussions, which causes CTEs, by making sure the athlete doesn't return to play too soon.